on the phone the editor of the investigative fund at the Nation Institute on her piece, Americans Are Working So Hard It's Actually Killing People, Esther Kaplan. And we should note that your piece was reported with the support of a fellowship from the Alicia Patterson Foundation and appears, of course, in the upcoming November 17th issue of The Nation magazine. Esther Kaplan, welcome to the program.
Well, thanks for having me, Sam. It's a great show.
Thank you, Esther. That's nice. Now, your piece is a great piece and really disturbing in, just about every respect. And I have to say, it really resonated with me. My mother-in-law is a nurse, and for the sake of her maintaining her job, I'm not going to say where, but she has been talking about this dynamic for the past couple of years, and it's been sort of stunning to watch and disturbing to know that it's one that is widely, I guess, experienced. Tell us about Jessica Wheeler and Wilkes-Barre General Hospital in Pennsylvania.
Well, what's happening there is probably one on the extreme end of things, but it's happening in hospitals all around the country because the nonprofit and public hospitals are being squeezed by budget cuts. But this hospital, Wilkes-Barre General, out in northeastern Pennsylvania, kind of former coal mining country, like hundreds of hospitals across the country, was snapped up by a big national for-profit chain, Community Health Systems. Now, the biggest chain in the United States. Many, many hospitals are now owned by for-profit corporations. Just a generation ago, this was not true at all. It's a massive shift in what's going on, and they're bringing this corporate cost-cutting agenda. So I talked with nurses there and at other CHS-owned hospitals, and everywhere you see this pattern where nurses leave their jobs and they don't fill the vacancies, and it results in staff cuts of 10% or more and just completely untenable patient loads that are creating extreme risks for the patients at the hospital and also for the nurses. I mean, emotionally, these are nurses that have to pop Xanax and antidepressants and sleeping pills just to make it through their work week, and nurses who are going through brutal surgeries because they have to turn obese patients without the proper staffing. It's not a pretty picture.
What is it about that has happened in the past 10 years that has created, I mean, and I want to get into some of the sort of the broader issues you talk about in the piece in terms of rising productivity for workers. And we talk about that quite a bit on this program, but we'll talk about what it actually means on the ground. But before we get there, but in particular in the sort of the medical industry, like what has been the dynamic that has created this concentration? Is it simply, is there something specific that is going on within the medical field or the hospital business that is creating this type of concentration?
Well, I think it's a lot like what we're seeing happening in the public schools, where corporations are seeing a big pot of money and thinking, let's go into this sector that has been previously controlled by nonprofits and government entities. And generally what CHS, the chain in this case, does, their model is to go into smaller towns or rural areas where there's no competition. They buy a hospital. They don't go into places like New York City or Philadelphia with lots and lots of hospitals competing for patients. They go where it's the only hospital serving an area or one of two. They buy it. They jack up the prices. Some of their hospitals are among the most expensive on a procedure by procedure basis in the entire country. And then they slash the staff. And, they're just taking an opportunity to turn what is really a public good, healthcare, and turn it into a profit center.
So let's take a moment and speculate as to what's how they approach this. So in other words, I mean, they basically just say like, we can go in, we can cut back on the service, we undoubtedly have streamlined procedures so that we can get the cost down, and we can just cut back on the service because there's no competition. The bar to entry in terms of somebody coming in and starting a new hospital is so high that it's never going to happen. And we can get away with this. What about, is there any, like, is there been any sort of legal pushback? I'm talking more like civil pushback because, I mean, if I was to read your piece and I was a trial attorney, the first thing I would do would be to contact some of these nurses to see if I could find out who their patients were. And I would sue these companies. I mean, I mean, what is?
Well, they've been the subject of a lot of lawsuits, both from labor unions over health treatment and also patients. They've also recently just settled with federal attorneys over a massive scheme to overbill on Medicaid, I think it was, or Medicare. $98 million settlement just a couple of months back. So yeah, they are scofflaws, CHS.
But I mean, are they subject to any, like, I mean, is anybody going in there and saying, you know, malpractice? I mean, somebody has passed away or somebody's not getting the treatment that they need in this situation? Have there been a lot of any type of litigation in that way?
Well, there certainly have been malpractice suits. I did not look into whether it's higher than with other hospitals. I mean, obviously all hospitals carry massive amounts of malpractice insurance because that is a danger for them if they do get sued. There are sometimes, even at the best of hospitals, there are poor health outcomes, and people will try to find a bad guy in that scenario. But yeah, clearly, in my view, they're making strategic decisions about staffing that are putting their patients at risk.
All right, so let's move on to like sort of the broader dynamic that's here, because this isn't just confined. I mean, A, this isn't just confined to the medical profession, and right. B, it's not just a question of people dying, really, at the end of the day. I mean, it's when we talk worker productivity, we talk about it usually in terms of it outpacing wages, but it really has to do with the fact that corporations are just taking profits, and we're subsidizing corporate profits, and people are. It's sort of amazing that in this day and age, we're working that much more than we did 10, 15, 20 years ago and getting nothing for it, but even having to do that.
Well, I mean, that's the irony of this current economic landscape. I think some of us are out of work, and some of us have been out of work for a very long time, and some of us can only get part-time work. You know, people at Starbucks and McDonald's and so on who are just scrambling to even get 18 hours a week, 20 hours of work a week. And then other people are being worked to the breaking point. I mean, to the absolute breaking point, because there hasn't, I mean, part of this doldrums in terms of hiring is the people who do have jobs in many industries are just being worked until their bodies are literally broken. And I mean, I talked to folks in a lot of different industries that didn't even show up in the piece, like hotel workers, you know. They have the same number of rooms that they're supposed to do per shift as they did 20 years ago, before it was king-size beds and 8 pillows and 3 layers of duvets, and the injury rate among hotel housekeepers now outstrips the people working in the commercial kitchens. Wow. And they're getting trauma injuries from slipping and falling, and they're tearing their shoulders out trying to change sheets so rapidly. I mean, everywhere you look, I looked at meat packers in the piece. I mean, it's just the incredible stress on people's bodies. We look at productivity as a great thing. That's America. We're more productive than other nations. Our GDP grows and we're more productive, and it's, you know, hooray and hurrah, but it's really good for corporate bottom lines, and workers are being pushed to the absolute limits. I mean, it was amazing how many different industries I spoke with people where they have to pop Tylenol to get through work each day. I mean, that is a sign that your body can't take what it's the workload that's being dumped on you.
The stuff about the meat processing workers was incredible. Let me just read a little bit of these statistics. You were talking to Juan Martinez, who worked, I should say, at a Cargill beef processing plant near Omaha. His crew had to slice up. I mean, this is sort of it's a little bit it's disgusting and it's disturbing. His crew had to slice up 4,600 20 to 30 pound pieces per shift. In the 4 years he was at the plant, from 2003 to 2006, the number of people at his station dropped from 8 to 6 or 7, while the parts kept coming. So in other words, you've lost something like 15% of your workforce. Or you can look at it as your work, the amount of work that you had to do rose by 15%.
To 25%.
Yeah. Another meatpacking worker, when he started, he says they killed 1,000 cattle in a 10-hour shift. Now they kill 1,100 in 8.5 hours. You found line speeds in meatpacking and poultry. They're going faster, and they're trying to raise the caps on this. And you talk about this dynamic taking place across a whole raft of industries. But let's talk about this notion of how we are sold this idea that a continuous increase in productivity is somehow something that we want. Aside from the fact that workers are not getting the benefits of it, maybe there is some type of theoretical value to it. But what is it supposedly is the theoretical value?
Well, you read any kind of intro to econ textbook, and it tells you that the only way we're going to get a better standard of living and increase our prosperity is by increasing productivity. This is how it's done. But as you've covered on your show, that model is broken. The idea was that the gains from that increased prosperity would be shared with the workforce, and it's not. So now, whereas once upon a time, workers might have been, okay, I'll work harder if I get a raise, maybe that's worthwhile. Maybe it's worth, risking breaking my back or carpal tunnel syndrome in my hands because I'm getting paid, I'm supporting my family. That's not even true anymore. I talked to one labor economist who said, there's such a gap between the increased productivity and increased pay at this point that you can't even really say workers are consenting to this. This is overwork being imposed from above, and there's absolutely no benefit that's trickling down to the workers. And I feel like we need to start questioning this gospel that increases in productivity are always good. Good for who?
And the way that they're getting to workers, I think you quoted a 2010 survey from Monster.com. Now we're nearly 4 or 5 years out from that, but there's no real reason to believe this dynamic has changed anyway. But that 53% of respondents had taken on additional duties since the start of the recession because coworkers had been laid off. Intuitively anyways, it would appear that the reason why one does this is essentially blackmail, right? Because you'll be out on the street as well.
Yep, and that's the dynamic. We have shrinking labor union presence in the private sector. We have this very slack labor market. So employers have enormous leverage, and this is how they're using it, to squeeze the last drop of sweat out of everyone on their payroll.
Is this sort of dynamic? Do you think it's permeating any of the sort of the national consciousness? The only time I see this disparity between productivity and wages, for instance, which is also the only time that we see any scrutiny on the increase of productivity, is in the context of the minimum wage fight. Right. It doesn't seem to nobody seems to sort of question the rise in productivity and the disparity in wages across the board in any other context. And nobody then seems to question just the notion of like, we've dropped the important assumption in the desire for increased productivity.
Well, I think this is one of the problems in our national debate is all the stress that people are experiencing on the job. We personalize it. We have a giant literature, if you want to call it that, of, struggling with work-life balance and all this stuff, as if it's just my problem or your problem that, oh, wow, I'm really having trouble dealing with the pressures of my job and my family, when this has to do with these big trends in corporate America: unpredictable scheduling, mandatory overtime. I mean, all these things that are pushing people beyond the limits where they can actually manage their lives. And yet we talk about it as if this is, just, mom engaged in her juggling act of trying to be, a worker and a mother. And we don't look at the structural problems that are at play, and we need to.
It's interesting because that's the same dynamic we saw. We talked about a piece the other day about the end of retirement, and when I talk to people who gone across the country and talk to people who are dealing with foreclosure, same exact dynamic, right? I mean, it's all. I've made some bad choices in my life.
Exactly.
I failed to do certain things, as opposed to seeing the sort of greater systemic dynamics that are at work here. But Esther Kaplan, thank you so much for coming on and talking about it. Hopefully, we'll hear more about this notion of. And it really is sort of like just a religion now, isn't it? That increased productivity will bring us that manna from heaven, even when it doesn't. Yeah,
well, I think that people's lived reality is going to start making them ask these questions.
Let's hope so. And let's hope that they tie that in to broader systemic problems rather than just, man, I shouldn't have been a nurse or something, I guess.
Right.
Esther Kaplan, the piece is Americans Are Working So Hard It's Actually Killing People. It'll be in Nation's November 17th edition. Thanks so much for coming on and talking about it.
And I should say it is online now.
It is, and we will put a link to it at majority.fm. Esther Kaplan,
All right,
thanks so much.
Sam.